Officials right across the country, including our Prime Minister, urging Canadians to get any vaccine that is available. But what if you have safety concerns? As we know, there are 4 vaccines available right now here in our country, but are they right for you, especially those who might have compromised immune systems? CityNews web writer and reporter Dilshad Berman joins us now with some of the answers that she's been getting from Toronto's Associate Medical Officer of Health. Good morning, Dee. How are you?
I'm good, Mel. Thank you so much. Yes, as you said, vaccine rollouts have started. We're going to get into phase 2 very soon. And phase 2 is actually going to include, like you said, people from 60 to 79, but also those who have high-risk chronic conditions. Now, that can include something like autoimmune conditions. Now, as you said, I have been chatting with Toronto's Associate Medical Officer of Health every week in a Q&A. And as we get closer to the phase 2 vaccine rollout, we've seen a lot of questions about whether or not the vaccine is safe for those who have autoimmune conditions, because, of course, the very point of the vaccine is to elicit a response from your immune system. So here's what the doctor had to say about that.
The answer is yes. It's safe if you have an autoimmune condition. What we just say is that you're better off talking to your doctor who has prescribed your medications to see is there a timing? Should you get it at a certain point so that you make sure that you get the best immune response that you can get despite your condition? But there's no reason to think that it's unsafe if you have those conditions. We just don't know how well it will work, but it still is something that you can get and would be recommended.
Okay, Dee, and interesting, the distinction here between safety and efficacy, and we really need to make sure we draw the differences between the two.
Yes, absolutely. It is safe. It's just a matter of how effective it's going to be in you based on your medications, based on the timing of your medications, that kind of thing. But it's not going to do you any harm. And that's something that officials have been saying over and over, is that the vaccines are by and large safe. Even if you have allergies, the vaccines have very few ingredients as it is. And within those very few ingredients, there are ingredients that may cause an allergic reaction. But if you were allergic to them, you would likely already know about it. It's very, very rare to have those allergies. In Pfizer, I believe it's polyethylene glycol. In Moderna, it's tromethamine. In AstraZeneca and Johnson & Johnson, it's polysorbate 80. So those are the names you need to watch out for. But again, allergies to that are very rare.
Okay, you've been doing this, as you say, every week with Toronto Public Health. How can people submit their questions? Because I know we constantly get them here online.
Yes, absolutely. So we have a special topic page set up on our website. It's citynews.ca/COVID answers. There's an article there. You can go in. There's a chat window. Submit your questions. We moderate them on the back end, and then they will pop up, and I will ask them to the Associate Medical Officer of Health, usually Tuesdays or Wednesdays.
Okay, love it. Dee Berman, citynews.ca if you want more information or if you want to submit a question for her to get answered. As always, we appreciate your time. Thanks, Dee.